So good news that Gauteng is officially out of the fourth wave, and it seems there's growing hope. We're moving towards a more manageable phase of the pandemic. Certainly, if we look at tonight's numbers that have just come out in the past 24-hour cycle, some 5,244 new infections. Western Cape leading with 1,389, Gauteng 1,061. KwaZulu-Natal 984. And if you look at that positivity rate of all the tests done, only 13% are coming back positive. So there's really a lot less of COVID circulating in society at the moment. The deaths, though, 59 deaths in the last 24 to 48-hour cycle. Now, this has been slightly amended. We used to give a 24-hour cycle of deaths, but we know that there's been catch-up with delayed data suddenly being added to the stats on deaths. So that's why the Department of Health is just creating a slightly bigger category or time category for deaths, 59 deaths. So the deaths continue, so we shouldn't be completely at ease. I'm joined now by Vaccinology Professor Shabir Madhi, Dean of the Faculty of Health Science at Wits University. Professor, always great to chat to you. So some positive news from our Health Minister this morning. We're seeing the numbers pretty much staying really low. Gauteng's out of the fourth wave. Is there a pattern with the way pandemics move and the way viruses move through a society? And if so, are we at the end of a specific pattern?
So good evening. And yes, there is a pattern to the manner in which viruses move through society, as well as the evolution of immunity and protection against the consequences of a viral infection. At the same time, the virus might change its characteristics to better be able to survive and continue its replication. What we've seen in South Africa, as you've mentioned, compared with the third wave, the Delta variant wave as an example, is a complete decoupling of the infection rate and the death rate. So if you look at Gauteng as an example, the number of, since the start of the pandemic, about 50% of all of the people that died of COVID-19 in Gauteng occurred during the course of the Delta wave, the previous wave that just passed. The current Omicron wave is contributing to less than 5% of all of the deaths that are occurring, that have occurred since the start of the pandemic in Gauteng. And this is a picture that's very much transpiring nationally. So what we're seeing happening right now is there are changes in the characteristics of the virus, but together with that, what's occurred over the course of the past three waves is evolution of immunity, both because of natural infection as well as vaccine-induced immunity. And even though that immunity doesn't necessarily protect too well against infections, it does an extremely good job in protecting against severe disease. So what we're reaping now is the benefits of immunity against the virus, but unfortunately, when it comes to natural infection, it has come at huge cost in South Africa. It's come at a cost of loss of 290,000 lives before we've had about 2/3 of the population that have been naturally infected and subsequently have developed immunity as well.
How many lives did you say? Lives lost?
290,000. And this is based on the South African Medical Research Council excess mortality estimates. The 92,000 that are recorded by Department of Health is a complete underestimate. The South African Medical Research Council excess mortality data is much more accurate, and that's 290,000. In South Africa, that puts us amongst the top 10 countries with the highest COVID-19 mortality rate globally. We're sitting at about 480 per 100,000, compared to, as an example, the United Kingdom that sits at about 200 per 100,000. So we have not been spared the consequences of COVID-19, despite, unfortunately, the number of restrictions that were imposed. And to a large extent, unfortunately, those restrictions failed dismally when it comes to having protected people or reduced the number of people that were infected, simply because those sort of restrictions don't work in the context of South Africa, unlike imposing those sort of restrictions in a country such as China.
Speaking of restrictions, today we heard that we're going to be living under a state of disaster for another month. Do you think that is a wise move?
It's not a necessary move. It's unnecessary completely at the stage of the pandemic. We're way over the worst. In fact, if the virus mutates to such an extent that it becomes more aggressive and starts evading even immunity that protects against severe disease, then we pretty much have got another pandemic on top of a pandemic. And that is extremely unlikely to occur. So I'm unclear as to why we're needing to perpetuate a state of disaster, because we're in a very different phase of this pandemic. In fact, what I would refer to it as being in a convalescent phase of this pandemic. We're not out of the pandemic. We are going to get another resurgence, perhaps another 2 or 3 resurgences, but we're not going to observe the large number of hospitalizations and deaths that transpired in the past. And we need to recalibrate completely, and it's absolutely essential that we don't do any further harm, indirect harm, to the economy, to the livelihoods of people, the education of children, and society in general, by pretending that we're doing any good by having these types of restrictions when it's simply not needed in the current context.
With that in mind, let's specifically drill down into schooling. We know that inland schools open this week, coastal schools open up next week, and many of the schools, most of the schools in fact, are still on this rotational system, one day on, one day off, because a lot of the poorer resource schools just don't have the extra classroom space to space the kids out. So they have to divide the school in half, essentially. Do you think that rotational schooling needs to end immediately?
Absolutely. And that's sort of a policy by Department of Education, which is justified under the pretext that we've still got COVID-19. We're going to have COVID-19 for the rest of our lifetimes. And that's not an excuse to continue with those sort of policies in the Department of Education. The bottom line is that you having 10 people in a poorly ventilated space is more dangerous than having 50 students in a well-ventilated space. The number of students in a class is immaterial. It's all about ventilation and, if you want, face masking. Now, we need to understand that the amount of harm that's been done to children over the past 2 years is something that's close to irreparable, especially children in their formative years. And for us to continue perpetuating, depriving children of education, of a social engagement, of nutrition, it's highly irresponsible and completely unwarranted. During this course of the pandemic, immunity has now evolved against severe disease. Children have not been at risk of severe disease since the start of the pandemic. The National Institute for Communicable Diseases has shown that there was no association between transmission in the community and the opening of schools. Children have not been responsible for infecting adults. The key issue in schools is the protection of teachers who might be at risk of developing severe disease, and the way to deal with that is not to punish children by keeping them out of school and restricting their access to school. The way to deal with that is to have teachers fully vaccinated, and that will sort out all of the problems that exist in schooling when it comes to getting back to to normality within the school environment.
How concerned are you about the low rates of vaccination? Now, we know that actually it's mostly sort of 20 years up to, I think, around 35 where it's really low. Somewhat better in the over 50 and the over 60. So I know that you've always said that's the cohort to really concern ourselves with. At this level of vaccination where we are with older people, how protected will we remain?
So the serious survey where we test for the presence of past infection or any sort of immunity from past infection or from vaccines, which we completed in Gauteng just before the Omicron wave, showed that if people above the age of 50 were unvaccinated, their seropositivity was 69%. So a large percentage of them, they have got protection against severe disease. If they were vaccinated, that goes up to 93%. But the difference of 20% between the two, between a vaccinated and unvaccinated over the age of 50, that difference is contributing to 85% of the hospitalizations of the ventilated patients in particular, and of people that are dying of COVID-19. So I'm really not concerned about low coverage in people under the age of 35. In fact, it's immaterial with Omicron because these vaccines don't do much when it comes to protecting against infection due to Omicron. But when it comes to people above the age of 50, if there's one single thing that we need to do over the next few months is put all of our efforts and all of our resources into getting at least 90% of people above the age of 50 vaccinated. And then we'll be in a much, much better space than we are even now with our Omicron wave, where we've seen substantial lower number of hospitalization and death. But still, those numbers are not immaterial.
The doubters would say, oh, but you know, Omicron's less severe, and it seems we're getting to the tail end of the pandemic. I've had my doubts about the vaccine. Why should I bother now?
Yeah, so Omicron has not been less severe. What's been the reason why we've experienced a less severe pandemic is because of people having developed immunity, like I said, both from natural infection as well as through vaccination. If people have been infected in the past, and we only know about 10% of the people that have been infected in the past because of our testing rate to start off with. But even when people have been infected in the past, they still stand to benefit, in fact, even more so than people that receive 2 doses of vaccine that haven't been infected in the past, in that the immune responses that is induced following natural infection with the vaccine is much superior, and it actually protects you not only against severe disease and death, but also probably protects you much better against infection and mild COVID, even against Omicron. So there's still huge space for us to improve our vaccine coverage. And certainly when it comes to people that gather indoors, in institutions, in workspaces, the issue of mandatory vaccination, however much people might not want to hear about it, is still very much on the table. Because we are needing to make sure that no one suffers. And when an individual that has not been vaccinated ends up in hospital, that individual is draining resources from the entire country, because there's an unnecessary hospitalization, an unnecessary ICU admission that's taking place that costs the country 20,000 rand per day per individual.
All right, thank you so much for chatting to us this evening. Professor of Vaccinology, Shabir Madhi, he's Dean of the Faculty of Health Sciences at Wits University.